You're with Dr. Shane, the founder of The Posture Doctor. Today we're going to look at some key exercises that I implement into my life to help me with a back injury that I sustained when I was 27 years of age. Now, at the age of 27, having no back problems at all, being extremely fit and healthy, I ended up rupturing a disc just on a routine run with a friend up and down some hills in Florida. As a result of that, I ended up damaging my disc to the point where I had pain 8 out of 10 for a period of 8 months, and that pain was 24 hours per day. It took me 18 months to stabilise my low back problem, and I tried numerous different types of stretches, different types of therapies. What I'd actually done was damage my low back as a result of having a structural problem and a short right leg. It had dropped my pelvis on the right, and my body had shifted to the left. So what happened is I ended up damaging my L5 disc on the right hand side. As a result of that, I tried different stretches and different techniques, and these are 3 things that I do on a daily basis to improve the health of my discs and spine in my lower back. The first one I'm going to show you is the spinal warm-up. When I wake up in the morning, before I load my spine with standing, I go onto my hands and knees, like so, and I stretch my belly button to the floor, I look up to the ceiling, I stretch my spine to the ceiling, and I look down through my legs. And I will do this 30 or 40 times. To me, this is a bit like warming up the engine in your car, especially when you've got a brand new car. It's about preparing your spine, getting heat, warmth, fluids, nutrition into the discs. So this is how I start my morning every morning. And what you can do is you can try and make the high point high in your back, and you can move through your spine, getting the stretch at different parts of your spine. Now, as you can see, my spine is very, very flexible because I've done this exercise for the last 17 years. When you start off on this exercise, you may feel stiff and your movement may only be very, very small. So just take the movements gently, don't force it, go nice and slow. Once I've done that stretch, I spread my knees out a bit wider and I go around in circles. Now, the object of this exercise is to keep your spine perfectly straight and just allow the stretch to occur down in the lower joints of your spine. And then we go back the other way. Now that is exercise 1. The second exercise I do, because we spend so much of our time in a forward flex position, at the end of the day I like to lay on my stomach and, relaxing my legs, arch back up to the ceiling. Now this movement, once again, is to be done slowly. And what we're doing is we're taking the lower spinal joints and we're taking them into what we call extension. Now, all of these movements that I'm doing now do not cause me any discomfort. They may cause you discomfort because the joints have not moved properly. You may have areas in your spine which are fixated, which chiropractors call subluxations, that may need to be adjusted before your spine can go through a full range of motion. As you become more flexible in the spine, you'll be able to stretch further back with the low back, keeping the discs nice and healthy, keeping the joints nice and healthy, because they're going through a full range of motion. Now, there's no magic number as to how many exercises you do. I do it until I feel my spine's moving well, warm. You may start off with 5 per day. You could always do a couple of sets of 5 or move into more. You can hold the stretch if you wish, or you can just move your spine. It's entirely up to you. Pay attention to your body and listen to what your body is telling you. The third exercise that we do is about improving the strength of your core. Most of my patients have been prescribed these exercises. We start off with the left leg stretched back and the right arm forward. This will test your core. You move your elbows to your knee, and it's a slow, deliberate movement. The second side, right leg back, left leg forward, turn the palm up, pull the elbow to the knee. Now, the more advanced way, we lift the knee, the left foot off the ground, and we work that same movement. We swap to the other side, knee off the ground, nice and slow. And this is really testing your core, and it needs to be done nice and controlled. And you can work this exercise, a couple of sets of 5, starting off nice and slow. So they're the 3 exercises that I do to help with my low back. One is about core strength. The other one is about lubricating the joints, moving the spine. And the extension is about taking the spine into the movements that we don't normally spend much time in throughout the day. I hope these help. Once again, if any of these exercises cause pain, stop doing and seek advice from your chiropractor.